came up, can Egoscue help with the herniated disc specifically? And I wanted to share this story with this client because I've been working with him for a while. He had herniated discs, came up in the MRI when we first started working together. And this past weekend, he had like a little party with his wife in his apartment, and he was decorating, and he was like taping balloons up to the ceiling. And honestly, when he started to tell me the story, I was like, oh no, like, did we go backwards? Did he have like a back spasm? Because he was saying my back was hurting. I was feeling like the same kind of the beginnings of that same nerve system symptom that I used to have a long time ago. And he was saying like all these things started to feel like they were coming back. And then I was like, no. And then he said, but then I did my menu and I felt better. So I was like, oh, okay. So this is a good outcome. he was saying that he noticed, so in our sessions, we were able to determine that the left hip flexor is the more dysfunctional side. And a lot of his previous symptoms were on the right side. So he would have nerve pain down the right side, muscle spasm on the right side of his low back. So everything was hurting on the right side, but the dysfunction was on the left. And he knew this, he knows this at this point. And so as he's telling me the story, he was like, I noticed that every time I stepped up on the chair to put a balloon up, I kept stepping up with my right side. I kept loading my right side and I would come down on my right side. And he was like, everything that we've been talking about, I just realized I was doing it again. Like I was just relying on the right side and not using the left. So he was like, when I noticed that, I switched and I tried to use both sides and use the left a little bit more. He said that just that little switch immediately started to help. He was like, but I had already done like so much work that I still had like a little bit of muscle pain and started to feel that nerve stuff. So he did his menu, then he did it the next day. And he was like, I'm doing so much better. So to answer the question of like, can Egoscue help with the disc herniation? Like, I just thought that that was such a really good example of someone that went from being super scared and worried and concerned about having a herniated disc show up in an MRI when he was like 30. And he was thinking like, I'm 30 years old with a herniated disc. What's going to happen in 10 years? Like, what does this mean for me in my life? And to us working together, and now, is his herniated disc gone? Probably not, considering that the symptoms were returning, but has he improved enough to live better day to day and to know what to do if there is some symptom that wants to start to make its way back in? Like, he knows what to do. He understands his body. He knows that he loads one side more than the other. That probably caused the disc to herniate to begin with. And he knows exercises to do to reset it. So to answer the question, like, can Egoscue help with the herniated disc? Like, absolutely yes. And it's just really cool to have that very clear example with this client of mine.
Talk about self-sustainability too, right? Like knowing what to do, why it's happening, and then what to do if need be to kind of quell those symptoms down if they pop up again. Mm-hmm. What are some common things that you see in the clinic lead to herniated discs happening?
That's a really great question. I think a lot of it comes from deviations in like the hip and pelvic position. So to go back to like just the definition of a herniated disc, right? The disc between the vertebrae is out of place. It's pushing out of where it's supposed to be. So if you can picture or imagine your spine leading right into your hips and pelvis with your sacrum down between, if there are any deviations where your pelvis is one side higher than the other, or one side twisting forward, anything like that, where there's an imbalance, your spine has no base, but it has no chance to load evenly. And so now you're putting more force on the discs from one side or the other. At least that's in my experience. That's what I've seen is super common. What about you guys?
Yeah, I would say that, and also even looking hips and then shoulders too, like rounding in the shoulders and losing that mobility in the spine, and then also that mobility moving somewhere else, like for example, the lumbar spine, that becoming hypermobile, or creating this, we need equal parts stability and mobility. So it's almost like they'll flip-flop. So, and then they're like, why is my disc herniated? It's like, well, your upper back's completely locked. So even doing something as simple as, a pigeon-toed test to see, okay, if we can get the hips underneath the shoulders, like now we're not breaking that vertical load, not fighting gravity. So that's a good way to test that. Like, okay, if I stand pigeon-toed and I feel like more upright, are my shoulders playing a role in why my back's hurting? That's a good little quick test.
Yeah. And on the other side of that too, like with the hips and pelvis, if you put your hands behind your head, that changes the hip and pelvic position, or the way you feel your weight. Like if your weight is heavier on one side versus the other, or is it heavier towards the front? Like if that changes, that's another really great test to see if your shoulders, if your upper back plays a role in what's happening down below.
Mm-hmm.
Yeah. And going off that too, right? Like you guys are saying, like it's oftentimes it's the areas surrounding like the lumbar spine. You know, if the herniated disc is in your lumbar spine, it can really happen anywhere. And what commonly we'll see at lumbar spine, you know, upper body alignment, Christy, like you were saying, shoulders, and Elisa, hips, and even just like knee and ankle function too, right? Like the ankle function will impact knee function, which then can impact hip, can impact shoulder, then vice versa going down. So it really can be dependent, you know, person to person. And that's why there's no like defined sequence or protocol, you know, for these herniated discs. It all depends on the individual, you know, that we see for the client, and these factors are these mechanisms that are leading into their symptom that they're feeling. So.